It's Tuesday, which means for me, it's Testosterone Tuesday. And I figured today I was going to take you guys along with me because on both YouTube and TikTok, I've gotten a lot of comments recently asking for, oh, do you have any advice for giving yourself a shot? I'm going to be taking my testosterone soon and I'm nervous about giving myself the shot. So, like, any advice, how you take the shot. So, I figured just take you along with me and hopefully be able to give some advice to everybody and, like, calm you down, how to, hype yourself up to do it. But also, I was very fortunate when I went to get my testosterone prescription. They gave me like a step-by-step rundown of how to give yourself the injection, and they had me like do practice and like do all the motions myself before, once I felt comfortable, before they sent me off to go take the shot myself. But I've heard that not everyone's doctor does that, so this video can also be for those people who need some help and some guidance on how they should take their shot. Or just like guys who are pre-T who once they like just want to know what to expect once they're going to start testosterone. Because I know when I was pre-T, I watched a lot of videos like this, just like trying to figure out what to expect when I'm going to be giving myself the testosterone shot. So first, let's get started with the supplies you'll need. And before we get started, I would like to say this video is for specifically intramuscular injections, intramuscular testosterone injections, because there is another type of testosterone injection you can do, which I forget the name of. I'll put it on the screen here. But this is for intramuscular injections. It's going to be different if you're doing the other injections, so this is specifically for intramuscular. I'm sure some of the things are similar, but I don't want to give anyone the wrong information. So putting that out there before we get started. Side tangent. The reason I chose intramuscular injection is because I am a very skinny person and I was worried about it hurting and not having enough fat to inject into, because with the other method, you inject into the fat oftentimes like in your stomach, and I don't have a lot of fat there, so that's why my doctor recommended me to do intramuscular injections. So if that's something you're worried about, intramuscular injections are an option, and I do them into the top of my thigh, which is honestly like my most fatty area on my body. So if you're worried about that, there's one thing. But yeah, I guess the first thing we'll get into is the supplies you will need. So first, obviously, you need the testosterone, which your pharmacy will provide. And then you'll need, for intramuscular, 2 different types of needles. You have your injection needles, but you also have your drawing needles. Because testosterone is a thicker substance, you need a thicker needle to draw it out of the vial, and then you inject it with this needle, which we'll go over how you do all that in a minute. So those are the things you get from the pharmacy. But then you are also going to need to buy alcohol wipes. I just got mine from Walmart. It's a pack of, how many are in here? 100. Because you need to clean the testosterone vial, like the top of it where you stick the needle in, and you need to clean the injection area very well. I just took a shower, but I am still going to disinfect it with an alcohol wipe. These are like specifically what these are for. Disinfecting like injection areas and like medical stuff. So I still like to just take a shower beforehand so I feel clean before I'm injecting myself, but use the alcohol pads. And lastly, you're going to need band-aids, because when you take the needle out, there is a very high likelihood that you are going to bleed. Sometimes, the first time I did it, there was a lot more blood than I was expecting. So don't be alarmed if there's just a lot of blood oozing. It doesn't mean you did anything wrong. You just probably like went pretty deep, which is fine. But you didn't do anything wrong if there's a lot of blood. But also, if there's not a lot of blood, you also didn't do anything wrong. I've had both cases where it is oozing blood, and then other cases where it's just a little bit of blood. But either way, you don't want to put a band-aid over it. I have Minecraft band-aids because if I'm giving myself a shot, I want a fun little band-aid afterwards. So right now I have Minecraft band-aids. I'm almost out of my Minecraft band-aids. So I'm going to have to go to the store and get some more. I'm probably going to get a different one that aren't Minecraft band-aids because I gotta switch it up, keep it fun. And this leads us into our first tip of the video, which is to have on some background noise or like some music or a YouTube video playing in the background to just kind of calm your mind, and like so you're not just solely focused on giving yourself the shot and oh my god, I'm about to stick a needle in my skin. So I recommend either putting on music or watching a YouTube video. I normally watch a YouTube video, though I guess not really, because most of the time I do my shot, I'm filming for YouTube or like TikTok or something, so I actually don't really listen to stuff. But for this purpose, it will probably help you and calm you down. Which, kind of piggybacking off of that, if shots are something that really freak you out, I would recommend at least having like a meal or like at least a snack before you do your shot. I don't know exactly how it works, but I know like when you get a tattoo, they recommend like you should eat beforehand or you could pass out. I'm sure it's not as extreme of just giving yourself one shot. Better to be safe than sorry. So I recommend just having a little snack beforehand. Also, if you haven't eaten in a while, your hands might be more shaky, and you want your hands to be less shaky. I mean, every time I do my shot, my hands are still are shaking, but if you haven't eaten and your hands are already shaky and then they're shaking even more trying to give yourself the shot, so I would just recommend having a little snack. Okay, I think that's all the pre-stuff out of the way, so we can get into the testosterone part. So first, wash your hands. I just took a shower, so I didn't need to wash them. I washed them in the shower, but I'd wash your hands beforehand. I'm gonna take out the testosterone. Actually, let me move this camera angle. Okay, sorry you can't really see my face anymore. Hello. I moved you down so we can see better what I'm doing. So, first thing you want to do is open up your testosterone. Get your vial. And then it has a little white lid on the top. We're just gonna yoink that off like that. And then you're gonna get your drawing needles, which the drawing needles are going to be the thicker ones. You're gonna be able to, you can tell the difference. It might not show up very well on camera, but you can definitely tell the difference. This one is definitely thicker. I don't know if you can tell, but this one is definitely thicker. So you get the drawing needle, the testosterone, and you want the syringe. So with how mine are, my drawing needle is not on the syringe, and I need the drawing needle to be on the syringe to be able to get the testosterone in the syringe where it needs to be. So the first thing you have to do is make sure the drawing needle is on the syringe. So how we're going to do that is we're going to open up both of these packages. And you want to make sure so they have the little pulley tab, and you want to make sure do not touch this yellow part or the other one. Don't touch the blue part, because this is like a sterile area. You don't want to touch that. So just open it up like this and then set it down to the side. And then do the same thing with this one, except the syringe end is here. So this one's fine. So you can just... So open up this one, take out the needle, take out the syringe, and to take off, you're gonna take this off. I grab what you want to do is you're going to grab the cover and you're just going to gently twist, and it's gonna come right off. It's just super gentle, just gonna come right off. And you're gonna put this to the side, and again, the blue part, you want this part to stay sterile. So I just put it back in the bag. Don't touch it with your hands. So now we have the syringe, and we need to get this onto the syringe. So what we do is just, switch our focus, twist it on there. And do not twist it on there too hard, because I made that mistake and I could not get it off, and I was freaking the fuck out because I was like, how am I going to do my T-shot if I can't get the drawing needle off? Because do not put this one in your skin. Use the injection needle. But yeah, you just want to make sure it's on there good, but not too tight. Like once it's on there and it's not falling off, you're good. Don't make sure it's really tight, because then you're not going to be able to get it off. And I freaked out the first time that happened to me. So now you're all ready to get the testosterone. No. Alright, so now step 1 is done. So the next thing we're going to need to get out is our alcohol pads. We just need the one right this second because we're going to take our testosterone. And right here is where that little circle in the middle is where we're going to put in the needle to be able to take out the testosterone and put it in the syringe. And we need to disinfect that area before we put the needle in there. So what you do is you take your alcohol wipe and you just rub it on that little section for about like 5 seconds. Nothing crazy, just gonna, make sure it is nice and sanitized. So we're just gonna yoink off the lid. And everyone's dosage is different. Right now, mine is 0.25, which on my syringe just means 25 because it's not in points. So yeah, I realized I didn't show that very well. I was just in the zone. So I'm just going to redo that actually. So you take your syringe and in that little area, you just go straight down. No angles or anything, just straight down, and then you flip it. And what I do is I just take a lot. I take a lot and I bring it in there because there's going to be air bubbles, which you don't really want. So I take a lot, I bring it down to like 40, and then you push back up, and that will get some of those bubbles out. And then I bring it up to where I need it. So what, 0.25, that's 22, 24, all right. And then right now there's still some bubbles in there. I don't know if you can see that, but so I'm gonna take this off. There we go. So we're done with that. And there's still those bubbles in there, so I'm just gonna flick it till those bubbles go away. Okay, and the bubbles are all gone. So before you take this needle off to switch it to the other one, make sure you put the lid back on because these needles are sharp. Okay, and now we can take this off, and same as before, we just twist right off. And then we can take our other one, which again, don't touch the blue part because that's supposed to stay nice and sterile. And this one you can put on as tight as you want because we don't need to take it back off again. But just like before, you twist it back on there. And this one, if you do it really tight, it's fine because we don't need to take it off again. All right, gonna move the camera angle again. So with intramuscular injections, you need to switch which leg you're doing it in each week. So last week I did this leg, which means I'm gonna do this leg. So we're going to be using this leg today. And if I was worried I was going to forget every week, oh fuck, which leg did I inject into last week? So I honestly keep a little note on my phone of like, oh, I did it in this leg last week, I'm going to do it in this leg next week, Just to make sure, I don't accidentally ever inject the same leg 2 weeks in a row. I don't know exactly what that does, but I know you're supposed to switch. Okay, so now what we're going to do is we are going to grab an alcohol wipe again, get a new one, fresh new one, and rip it open. Okay, and now we're going to disinfect the area. And you want to do circular motions from inside out. So you start from the inside and then you do circular motions to outer. So I'm going to inject about right here is where I like to do it because that's just my thickest area, and obviously there's a little something in the way right here. So I put this down and then circle in to out, and the shot's like such a little area, but I just do like such a big area because why not? So yeah, circle inside out, and good for demonstration to do a bigger area. Okay, and now this is the part that stresses the most people out, and this is about the part where if I was not recording, I'd put on a YouTube video or some music. Before I actually do the shot, I'd also get my Band-Aid ready, just because I don't know how much it's going to bleed. Sometimes it bleeds a lot, and sometimes it only bleeds a little bit. So I got my Band-Aid, and I'm just going to open it up and have it ready on here for me to grab. I also, sometimes if it bleeds a lot, I want to make sure I have an extra disinfectant wipe on hand in case I need to wipe away the excess blood before I put on the band-aid. So when you're injecting intramuscular, I do, as you saw where I wiped off, I do the top of my thigh, and do not go in at an angle. You don't want to go in at an angle. You just want to go straight down, straight down. I just do a few deep breaths, like, all right, hyping myself up. I got my YouTube video on in the background to, you know, keep me kind of distracted, and I'm ready to go in. And honestly, the thing I was most worried about before I started doing my testosterone shots was that I was going to need to put a lot of pressure, and it was going to hurt, and I wasn't going to be able to do it. Like, I wasn't going to be able to give myself the willpower to just push it in. But trust me, needles are a lot sharper. Like, these are sharp. They're a lot sharper than you think they are. They're sharp motherfuckers. So it goes in like butter. You barely need to put, I mean, you need to put a little teeny bit of pressure, but it kind of just goes in like butter because of how sharp they are. So make sure you're always being careful with them. But if you're worried about, like, you're like, oh, how am I going to be able to push this in? I'm like worried, like it's going to hurt. It goes in like butter. You don't need to really put that much pressure on to get it to go in. All right, so now I don't have much else I need to say, so we're just going to do it. Let's see if I can zoom in. YouTube, this is for educational purposes. Please don't, like, restrict my video. So, got my leg all prepped. Gonna go straight down. So, take the cap off. Take the protective cap off. And see, it's not that, it's like maybe an inch of needle. It's not the super, can you even see it? It's not super long. The first thing I do is I just, you know, kind of press down with my hands so that way my thigh isn't really, I'm not like shaking, and it's just my skin is nice and secure. I don't pull at your skin, but I just, you know, put a nice pressure on my leg. I don't know, it just helps me personally. And then I kind of just get it in position. I don't do anything yet, I just get it in position. Remember, straight down. And some people, they might find it better to look away. I personally like to look and see what I'm doing. That seems just smarter to me. But, alright, and then I'm just going to lay it on the skin and push down. And pushing in. Alright, there we go. The initial push in is the worst part, because you do have to put a little bit of pressure, but then the rest of the needle just goes all the way in. Like butter, like I said. And then I move my hand away and use that hand to slowly push in the testosterone. I slowly push down on the white bit until all the testosterone goes in there. Takes about like 26 seconds. I timed it last week. Just because I do it nice and slow. Alright, and then alright, and now all the testosterone's out, and I just pull out, straight out. Pull straight out. Oh, and barely any blood today. Alright. I still am just going to wipe away the excess. Wipe that off. Barely any blood. Take my Band-Aid and just put that right where it's bleeding a little bit. Ooh, and it came off. Sometimes the Band-Aid doesn't like to stay because the area is a little wet from the disinfectant wipe, but just stick it down there. I also, when you're doing the shot, obviously put as much as the needle into your skin as you can. I go until, like, I hit this. I go till I hit this. I push it all the way in, which might seem intimidating, but like I said, it goes in like butter, and once you get the initial in, it really doesn't hurt that bad. But yeah, but obviously if you're feeling some resistance to get it all the way in, just stop where you are and just inject in there. Once you start feeling resistance is when you stop. And I normally start feeling the resistance once I get straight to the end because there's no more needle to put in. Okay, and that's it. That's how you take your testosterone shot. That's how I take my testosterone shot. I mean, I hope this was helpful to someone. I hope maybe I'm making you a little less scared to take your shot. Because really, to me, some people still hate it, but to me, it's really not that bad. I was freaked out to do my first shot, but once I did it the one time, smooth sailing from there on out. I hope this was helpful. If you have any more questions for me, leave them in the comments, or if you're on testosterone and you have any advice for anyone looking to, that's scared and looking for advice to help calm themselves down, before taking the shot, leave it in the comments, help each other out. Now I'm gonna go clean up all this mess I made, and I hope you have a wonderful day. Oh, I almost forgot. This is important too. Ugh. I have a bottle to safely dispose of all my used needles. You don't need to put the syringe in there. You can just pop off the needle part and put the needle in the bottle. But I just put the syringe in there too, because why not? Like, you can just dispose of the syringe part normally, but you cannot throw out needles. You can't do that. You can't just throw out needles. So the needles have to go in a safe container. I don't know what I'm gonna do once this container fills up. Probably gonna get a bigger container and put them all in there. But just boop, syringe, and the drawing needle, boop, and they're all in this bottle. I'm sorry. Yeah. Like I said, the syringes don't need to go in there. You can just throw out the syringes, but if you're gonna do that, make sure you take the needle part off before you throw it out. Okay, that's it.